This is a presentation that was first presented in November 2020 to the faculty and students of the Master in Nursing program as my practicum project. And I'm very pleased to be able to present again today to give you all a little bit of an overview of how this project unfolded. So just to, I'll make sure these slides forward. Just to give you an overview, the lymphedema management program at Central Health has been in place since 2011, and it really was the vision of a wound care nurse named Nancy Wright, who really wrote the proposal for the funding for this program. So the credit of getting the program at Central Health goes totally to Nancy, who has since retired. I was just a successful applicant who applied for the position. And one of the requirements of the position was not only that you be a registered nurse, but that you also were a certified lymphedema therapist. And I don't think there was too many of us floating around at the time. So this program has been in place since 2011, and I was charged with the development of the program, which has been definitely a work in progress since. The program is based on a logic model that consisted of 3 components. And 3 components are program promotion, lymphedema clinic, and community support. The program promotion part was done initially. That was kind of where I went around and did presentations in general on lymphedema. I spoke pretty much all throughout our region at the time. The lymphedema clinic, which is basically where the referrals go for the assessment, treatment, and management of lymphedema, pretty much takes up 99.999% of my time, which it shouldn't, but it does, and this is where we're struggling at the moment. But the other component is community support, and that part was to train champions in the provision of care for lower limb lymphedema, and the champions being the community health nurses at Central Health, and to provide them with resources and tools to assist with lymphedema management. And currently we have a one-day interactive workshop that community health nurses take part in as part of their orientation. So this e-learning resource is now an extension of that. For anyone who doesn't know a whole lot about lymphedema, the terms lymphedema and chronic edema are used interchangeably, and it's a broad definition, and basically it means that any edema lasting more than 3 months is potentially lymphedema, because the swelling in the tissues causes a constant inflammatory response that damages lymphatics and actually causes the true essence of lymphedema. It is a progressive and chronic condition that causes swelling usually in a limb, but it may involve the head, neck, trunk, or genital regions. And lymphedema is really thought to be under-recognized and under-treated, and a growing public health concern. And in Canada, it is estimated that up to 1 million people may be affected. So the impetus for this project is that nurses in community health are seeing increased numbers of clients with chronic lower limb lymphedema. And past evaluations of our one-day workshops held at Central Health have indicated that more education and information was needed on lymphedema care. So the purpose of my practicum project was to develop the e-learning resource for the continuing care nurses at Central Health on the assessment and treatment and management of lower limb lymphedema in the community setting. And it is lower limb we were funded for, because remember, this program spun out of wound care, and in wound care there is that link between chronic edema and non-healing wounds. So technically this program is lower limb, and the project focuses on lower limb lymphedema. So the development of this e-learning resource is meant to support the mandatory one-day workshop already available to continuing care nurses at Central Health. So now, some people might call it the dry stuff, but very important when you're working on a major project is you have to follow some fairly distinct processes. And the practicum project spanned over 2 semesters of my final 2 semesters at the Master of Nursing program. So the first practicum was the first semester, and that occurred last year from April to August. And it was to assess the learning needs of continuing care nurses at Central Health in caring for clients with lymphedema. And this was completed by conducting a literature review to investigate why a gap in lymphedema care was a problem and how education might be delivered to nurses to address this gap in care. And in doing that, I conducted consultations with key stakeholders, that being the community health nurses at Central Health and 4 of my nurse colleagues. I also conducted an environmental scan to search for any e-learning resources on the assessment, treatment, and management of lower limb lymphedema that might already be out there, because the thought is we don't want to reinvent the wheel. The focus of the final practicum, which was September to December, was to actually develop the modules. So a little bit about the methods. There was a comprehensive search done with the assistance of the librarian at Memorial University. Her name was Michelle, and she was fabulous. It helped me to search the electronic databases and really drill down and find the articles or studies that I needed to support the program. I used date boundaries of 15 years to try and get the most current information, and in the end I chose 9 studies for critical appraisal using the Public Health Agency of Canada's Critical Appraisal Tool for quantitative research and the Critical Appraisal Skills Program for review of any qualitative studies. So the literature review results really weren't that surprising to me, but just validated probably what I already knew, that lymphedema is a problem. And some Canadian researchers, Keystone Towers and Moffat et al., who's a British researcher, did report in 2019 and 2017 that there is a dearth of literature to support that lymphedema is a problem. And these authors, along with an American author, Roxanne and Rivera, have all suggested that lymphedema is under-recognized, under-treated, and a public health concern. Keystone Towers and Moffat all indicated there was a limited understanding of the true prevalence and impact of lymphedema, with them reporting that the total number of people globally with lymphedema is unknown, and that data on prevalence had been mainly estimated through extrapolation of data from existing databases, case ascertainment, and cross-sectional based studies. So while that many studies reported the lymphedema was a problem, there really was no plan to address the problem. And there was actually no studies out there that examined the use of e-learning in providing education or information about lymphedema to nurses. That took a considerable amount of time right at the beginning of the project. Consultations were held last June, so June of 2020. And the key stakeholders were the continuing care nurses, 71 of them from Central Health, and 4 nurse colleagues. The continuing care nurses worked at various community health clinics throughout the Central Health region, and the 4 nursing colleagues were the manager of home and ambulatory services, the director of home and ambulatory services, the regional enterostomal therapy coordinator, and the clinical lead for home and community nursing. Group were sent by email a letter with group-specific questionnaires to request input on the learning needs of the continuing care nurses in the assessment, treatment, and management of lower limb lymphedema. And both groups were also asked specific questions related to how this education should be delivered. I sent 2 reminders for them to complete it, and then the completed questionnaires were analyzed for content and thematic similarities. You can see that the response rate for the community health nurses was 22.5%, and some might consider that low, but I considered we had a small time frame in June in the middle of a pandemic with summer vacation in most people's minds and nice weather, I thought the response was pretty good, and the information that was contained in those questionnaires was really valuable to me. Of course, I did get 100% from my 4 nurse colleagues. Results of the consultations. Both groups suggested content on anatomy, physiology, and pathophysiology of lymphedema was needed, and the continuing care nurses specifically requested information on types and causes of lymphedema. The colleagues suggested there was a better need to understand the links between cellulitis, obesity, and wounds with lymphedema. And I can understand that because that is the big resource driver, and not only in cost of wound care supplies to treat these people, but also in resources of community health nurses. Other topics of interest were the use of Doppler for assessment, completing holistic assessments, appropriate skin care, and the use of various types of compression. Nurses viewed the e-learning module as an additional learning resource to supplement their one-day workshop on lymphedema care. And all consultation results were considered in the development of the e-learning resource going forward. The environmental scan was conducted, and I sent electronically, and everything was done electronically because of pandemic. It was very difficult to meet face-to-face with people, but everything was done electronically, and I sent it to 7 personal contacts and 11 website administrators. And what I mean by website administrators, they might have been provincial lymphedema associations or networks. The practicum project was explained, and confidentiality was assured, and all were asked to share any e-learning materials they might have. Their responses were analyzed for relevance to the practicum project, and any materials shared were reviewed for both the content and presentation style, because I was also interested in how the modules were illustrated, what kind of video links they used, how they tested their e-learning, etc. Environmental scan results showed that no one really had e-learning resources available that were specific to lower limb lymphedema. There's lots out there on breast cancer-related lymphedema, but not so much on lower limb. In addition, I was put in contact with a researcher from Wales who provided a lot of information for me, and some of it that I can use in other projects. The sources collectively provided external links to 3 e-learning modules and 2 sites with videos on assessment, treatment, and management of lymphedema. And these were external sites, some that you had to pay for and things like that. And all these e-learning modules did cover some of the components I was looking for, but none truly covered lower limb lymphedema in a community setting, shall we say. So on the completion of that first semester there last summer, I really did have the information I needed to justify the development of an e-learning resource. And so going forward in the second practicum from September to December, I actually developed that e-learning resource. So the e-learning resource consists of 3 modules, and the first module was a general overview of lymphedema, the second on assessment of lower limb lymphedema, and the third on the treatment and management of lymphedema. And these e-learning modules all contained evidence-based information on lower extremity lymphedema. I did follow the Knowles principle of adult learning to guide the development of the learning resource. Specifically, the principles of relevance and experience were considered. What I found in the consultations is that nurses wanted information and education that was relevant to their work and applicable to their practice. It was also recognized that nurses bring a range of experiences to their learning, and that they are encouraged to use this experience in the interactive activities and reflective exercises contained in the modules. Module reinforces information and allows for critical thinking by encouraging participation in a case study, interactive activity, quiz, and reflection exercise. Video links and illustrations and photographs are used to help support the learning objectives. And also there were additional video links provided for additional learning should people want to learn more. Next couple of slides are about, they basically show some snapshots of what's actually contained in the modules. And on your left, there's an example of a quiz, which is just a true and false quiz. On the right, there's an example of a video link, and this particular video link was of a patient's story, of a person living with lymphedema. It's my experience with treating patients with lymphedema, and a lot of my clients are morbidly obese with multiple comorbid issues that are often told that their swelling is because they're fat, and they just need to lose weight. And if they would lose weight, this would go away, or there's no real treatment for this. And they feel dismissed. So I feel having video links to patient stories is really important so that nurses understand that there is a person behind this problem or this issue or this condition. And that by listening to the person's story, you get a better appreciation of how it affects their quality of life big time, and affects things like mobility and their overall mental health. So I really encourage people to clients, and it's in part why when I conduct my initial assessments, I do a comprehensive history physical, and I basically listen to what they have to say. Because sometimes the goal of lymphedema therapy, what I think the goal of lymphedema therapy should be and what the client thinks it should be are totally different things. Some people just want to keep the wolf away from the door. They want to keep out of hospital, keep infection free. They don't necessarily want to have a pretty leg. Very important to listen to the patient. Other parts of the module contain videos on how to do things, such as how to put on stockings or how to measure for stockings. They're included in the modules. And then there's an appendices that include answer keys to the different quizzes, and also not only contains the answers, but where in the modules you can find those answers. There's also a glossary in the appendix, and the terms that are included in the glossary are bolded throughout the modules for ease of looking, terms up. This is an example of a reflective exercise that would be similar to what would be contained in the modules. And I really ask you to take some time to reflect on your own nursing and personal experience, to question whether you know someone with lymphedema. I ask, do you know persons in the community with chronic swelling? Then, have you ever considered that this swelling might be lymphedema? I would guess many don't. And does the swelling impact their care and quality of life? Can they manage their activities of daily living, have quality of life issues? I would guess that many do. And if you know these people, do you know how to get them some help? Many don't. Right now in Newfoundland, we have 2 programs within provincial health authorities that look after lymphedema. They are one-person machines. There is the Eastern Health Cancer Care Program, who Anne-Marie Cody is in charge of right now, and her predecessors are Jean-Ann Ryan and Martina Reddick. And their program is geared toward cancer care. However, I know they do dabble in other types of lymphedema. Likewise, the program at Central Health is geared to lower extremity lymphedema, but we do see other clients with upper extremity breast cancer-related lymphedema and head and neck lymphedema. But we are the only 2 programs within the health authorities. Western Health and Labrador-Grenville don't have specific programs, and both our programs at Eastern and Central are receiving increased numbers of referrals from these programs in the from these other health authorities in the province. Excuse me. So, you know, we're not quite there yet on managing this condition because 2 people in a province can't manage everyone. And then there is the private sector that people have massage therapists and physiotherapists might have in their clinics, but not everybody has the ability to pay or has insurance. So we'll have some work to do in this area. So lymphedema is considered under-recognized, under-treated, and a public health concern. People with lymphedema are at risk for cellulitis. Cellulitis can lead to sepsis, which is life-threatening. Many of the clients I see, if they get a cellulitis, do develop sepsis, and they can be admitted for extended periods of time, which is a huge cost to the healthcare system, as well as not to mention the cost to the patient when it comes to their overall health. So I challenge everybody that lymphedema is a problem that's probably a little bit ignored. So what are the next steps? This e-learning resource, and this was developed back in the fall when I was doing my practicum project, and the plan was to upload it to the learning management system at Central Health. Well, guess what? The only thing in healthcare right now that's consistent is change. So the learning management system at Central Health is no longer specific to Central Health. That's now a provincial system that the 4 regional health authorities are part of. So I'm thinking it's going to take some time to get it uploaded to that system. Whether we'll be up and running in the next couple of months on, say, the lymphedema program's intranet page that's housed at Central Health, I'm working on it. To all continuing care nurses, there will be an expectation for them to complete this prior to attending their workshop on lymphedema care. And the hope is that wherever we house it, that it will be available to other healthcare professionals as well who might like to learn more about lymphedema. Because it's not only nurses who need to learn, you will, even in talking to physicians, they have received very little training on lymphedema. And it's always frustrating to them when they have these clients because they actually don't know what to do with them. So I have a very good collaborative working relationship with many of the physicians at Central Health, and that's evidenced by the over 1,000 patients I have in my clinic. So I get quite a lot of referrals, and I have quite an extensive wait list at the moment. The plan was to present the practicum project to the management at Central Health. Now, remember what I said about change? Well, the only thing consistent is change. So in the last few months, I've had a change in director and a change in manager. My initial manager has seen this project, but there has been recent change in the management structure here at Central Health. So people right now have been totally consumed with the pandemic response with that second wave after Christmas. But the plan is to get this back on track in the next few weeks, and I do have a meeting in the next week with my new manager to discuss this project. I'm hoping to be able to present it virtually to the continuing care nurses at Central Health, and I know Margot is on the line here today, so that will probably be a discussion after I meet with management next week. And hopefully in the future I'll be able to present at a national conference. But as we all know, the pandemic has kind of really put a damper on our conferences and things like that. But I'm hoping that in the near future I might be able to present on a national scale this project, because the program at Central Health is very unique in that we're not a cancer-specific program, and there's very few programs throughout the country that are like ours. In fact, Accreditation Canada did recognize this program as leading practice, which I was very proud of. So just some acknowledgments. I do have to say a heartfelt thanks again to Dr. Donna Moraleo for her guidance and expertise throughout this project. She was my practicum supervisor for the Master of Nursing program, and without her I probably would never have gotten through this. To the continuing care nurses, colleagues, and management at Central Health for their input and support, I will be grateful forever. To the colleagues in the lymphedema world, for all their support. It really is a small global network that is very connected online, and I've always had support from the many people I've met along the way in the lymphedema world. And some of the researchers I quoted earlier are actually people I've met in person and have gotten to speak to them firsthand, which is, it's great to know some of these people. And of course to my husband and family who supported me throughout this journey. And I think if I told my husband I was going back to school, he'd probably divorce me. But most of all, this project was inspired by and dedicated to my son James, who lives with primary lymphedema. My son James is why I've initially involved myself in lymphedema care, and his journey with primary lymphedema has been the inspiration for my practicum project and why I've chosen to devote much of my education and professional practice to learning about and providing lymphedema care. And that's how I really became a lymphedema therapist in the beginning, back in I went to the U.S. to get training so that I could help him. I didn't really have a job in mind for this at that time, but he is definitely my inspiration.